Hi, Dr. Harvey. Today we'll be doing Microbotox using an off-label use of Botox for treating creping, oily skin, and just general skin texture using intradermal and not intramuscular injections. So the setup with Microbotox is a little different than traditional Botox. We much more want them to use a dilute version, and what we'll be doing today and what we've done is we use a traditional 100 units, but we mix it with 2.5 cc's of preservative containing saline, and then take half of cc of that dilution and mix it with 0.5 cc's of lidocaine with epi. What that does is it keeps the solution intradermal. So it basically comes out to a final concentration of 20 units per ml of solution. And basically what we do is then put these into our typical BD insulin syringes and give these microaliquots. Our patient is pre-marked, and a couple of attention points here. You want to be about 3 finger breadths above the mandibular line when you do this technique, and 1 finger breadth lateral to the oral commissure. What that allows us to do is to treat the sebaceous skin and avoid the muscularity of the mouth to prevent any kind of drooping. We then extend it to the tragus and inferior to the clavicle. Well, we'll then cross the midline to the opposite side, and again, being right at the mandibular line, avoiding this no-fly area. You'll see these little marks, and this is where we're going to place our microaliquots. Typically, you're going to use about 50 injections per side, and what this should do, and we'll take some post-op pictures too after she resolves, is to give a little bit more creping, a little bit more lift, and help with texture and some of these minor fine lines. She's already had numbing medicine on ahead of time, and we'll use a little bit of selective ice application as a way to provide analgesia. So I'll show you the first few injections, and then we'll see our patient in follow-up in 3 weeks with more video to come.
So as we start the process of injection, you can see I'm creating these little wheels superficially, spaced out about 1 centimeter apart. Usually we inject about 0.05 ml or so, and each of these dots are spaced about 1 centimeter to 1.5 centimeters. We note, because of the lidocaine with epi in the mix, after every bleb, you'll start to see the skin blanch and take on a lighter color relevant to the surrounding skin. And that just keeps that Microbotox solution superficial. We don't want to go deep on this. You shouldn't be seeing the absence of a wheal. You should always get a little bit of a wheal. It's like a miniature TB injection. What's great about this technique is we can extend it onto the neck, creating lift, creating the improvement of pores and smaller the accordion lines to get rid of those. And you can see my nurse placing ice just where I'm about to go to provide additional analgesia. You can also use a soft toy, contralateral vibration to distract the patient, but it is a real painless technique even without those other tools. We just kind of have some options here. It goes by pretty fast. You can see I've probably already done 20 to 25 injections. And here's the before, seeing the creping, the accordion lines, and the jowling. I want you to pay particular note of that. And then afterwards, we'll see the improvement in the mandibular line. Look at how that neck lifted, and the smoothness of the texture and the lack of oil glands. So all in all, a very elegant technique.